Morning, all. Hope everybody's doing good. Thanks for joining the working group this morning. It is 10:10, but I'm going to give it another minute or so. And while we do that, we'll put this in the chat a couple times, but decided to try something a little bit different today, and that is to create a shared space where we could work from. So Lindsay, if you'll put the link in the chat right on time, as she always is, it's a link to a Jamboard. And we're going to use that as a shared space so that we don't have to have a single note taker, but you can all put thoughts in without us having to go one by one, making sure we can capture as many ideas as possible. So go ahead and pull that up if you wouldn't mind. And then we'll let you guys pull that up on your own screens, and we will not share screen here. We will keep this as lovely faces, which I think facilitates a good conversation. And if anybody has it and they're not able to edit it, or you have any problems, let me know. Or let Lindsay know, rather, because she's much better at that stuff than I am. And for those who might be watching on the live stream service, we will share the information out in the notes that get distributed, because we know that it's a link that our folks who are watching are not going to have at the moment. So just for transparency. Well, it is 12 minutes after. I'm sure folks are coming in slowly. I'm not actually sure. I should have done a count beforehand to see how many people we were waiting for, but we'll go ahead and get started because I have some lovely faces here. Thank you guys again for joining. Sarah Gardner, I'll be your facilitator for the working group, and we're talking about childcare recruitment and retention. And Lindsay's put a link to the Jamboard, which we're going to use as a shared workspace today. Thanks, Lindsay. I also wanted to give a quick shout out to Tabitha Ewing. So Tabitha is a panel member, and she has agreed to be our fearless leader, our chair for this working group. Unfortunately, or very like on point, Tabitha has to be in ratio this morning. And so Tabitha was not available to join us today, which I think is a really good reminder of what the conversation we're talking about and why it's so important. She is a voice who wants to contribute to systems level change, and she is being asked to wear the many hats that she wears, that all of you wear as well, and be there for the kiddos that she serves. So, but we will have Tabitha with us hopefully in future meetings, and we'll have a role for her to help guide the conversation. Since we will have the shared Jamboard, I would really love it. I know Amy was the great volunteer last time to share out, but there will be a few minutes to share out. And if someone could, you don't have to tell me now, but would love it if somebody would agree to just give a quick recap when we get back to the full panel group. And again, you'll have the Jamboard at your fingertips. And so hopefully it will be a relatively easy task. And it's just a few minutes of sharing out. So someone could volunteer to do that. And then lastly, our subject matter experts, our content experts, Jen Pishney and Lisa Generate from our Department for Children and Families, childcare teams. So thanks, Jen and Lisa. So today we are going to work a little bit shifting away from documenting the challenges of recruitment and retention and moving towards actually building some solutions. We have on the Jamboard, if you want to go to slides 1, 2, and 3, you will see notes, and in the upper left-hand corner of each Jamboard is the sticky note that tells you what that Jamboard page is about. And so I captured some general comments, so just general comments about recruitment and retention of childcare providers. The second slide captures actual recruitment challenges, and then the third slide captures retention challenges. Recruitment and retention challenges look very similar, so you'll see a lot of overlap, but there are some unique differences. So for example, on recruitment challenges, there's the issue of onboarding and paying for the onboarding expenses of, especially if you're a center, paying for onboarding expenses of new staff who either don't show up past the interview, or they don't show up to work, or they work for a couple days and then they go find a different job that pays more money. So we know that's a huge retention challenge for our centers. So I'm going to give everybody just a minute to kind of review those stickies. And I've done my best to color code the information. I think one of the really interesting general comments, and I believe, Riva, this was credited to you, but the concept of it's not okay that our professionals don't make a living wage. And to accept anything less is doing ourselves a disservice. And that's a complicated solution for sure. But that being at the heart of things is really important to highlight. On the recruitment, I thought it was really interesting, the barriers to accessing private dollars, because you're not a 501c3. You're technically a for-profit business, although who's making a profit in childcare, I do not know. But that is a barrier to accessing philanthropy, which we know exists across Kansas, particularly the example of Northwest Kansas and the Dane Hansen Foundation, which is giving dollars and needing to be a 501c3. Riva, you've got the floor. Your hand is raised.
I just could not miss this opportunity to share a story I heard this week.
Please do.
A childcare center director shared that she was thrilled that she had received multiple applicants for an open position they posted. And as it turned out, many of them were nurses that wanted to leave the healthcare field. Some because of vaccination requirements coming down, but others were just burned out and wanted to do something else. And the story that got shared was the first wonderful candidate said, but I would need a starting salary of at least $26 an hour. And when the director shared that that was not going to happen in that center or probably anywhere in early childhood, this healthcare professional was just shocked that people would work for the wages that we pay in childcare with all the expectations. So from the outside looking in, people don't get it. You know, why would someone do this hard and demanding and important job for $10 or $12 or $15 an hour?
I wonder, we talked a little bit, I'm sorry, this is Amy Gotchammer.
Go ahead, Amy.
We talked a little bit about messaging and letting our society know, you know, how important we are, what it is we do. But to Riva's point, I wonder if there doesn't need to be some messaging about how little we make, because I would think that given for a family that really has no idea what's going on behind the scenes, but they know that they're paying $1,000 a month or something. That's a lot of money, and it is a lot of money. But for them to not understand that, you know, we put X percent into the overhead and the food and the whatever, and that just doesn't add up to a lot of money for wages. Maybe somehow we could find, you know, just some basic numbers, you know, X number of cents per dollar is all we can afford to put towards wages. You know, something like that. So they start to get a feel for how little is really going to them. And that the problem is that we don't want to have to raise the rates so high that they have to come out of pocket for it, you know, and you all know the rest. But
this is Riva again. There's a really great short video that Childcare Aware of America has put out on the economics of childcare. I'm going to find that link and put it in the chat.
This is Jen Pishney, and I also wanted to mention that costofcare.org has a really good interactive website where you can go specifically to your state. So you can go specifically to Kansas and then see how the, you know, decreasing the ratio, making sure that there are more adults per child, actually providing health insurance for our workforce really changes that cost of care.
I wonder, Jennifer, I'd like to see it because I'd be curious to see, does it break it down between, you know, centers or home providers? Because a lot of the overhead costs, you know, if you're a faith-based preschool and you're in a church and it's all paid for and you don't have to pay rent, that can change the amount that you have to charge parents, and therefore what you can bring in and pay to your staff. When you're quote for profit, there are a lot of associated expenses and nobody's there to offset them. So it just leaves you with fewer dollars.
So it doesn't, this is Jennifer again, it doesn't break it down to those particular circumstances, but it does actually infant, toddler, and preschool, in center, and then family child care. So I will also put that in the chat in a second.
We're working on strategic planning, and one of our goals is to look at, analyze how much it would cost to be able to increase our lead and assistant teacher pay so that we have competitive wages. And we have 35 lead teachers and about 40 assistant teachers, actually about 45 assistant teachers. And then of course, then our administrators, because we can't have our teachers making more than the administrators. And so it kind of like worked its way up or whatever. And so far our estimate is that we would need an additional $1.6 million a year in order to create a competitive wage, a living wage, you know, for our teachers, our staff. And that would, so one way to do that is to charge an additional $12 per day to families. But then our families are the ones who would then, you know, be kind of bearing the brunt of it, and we serve a low income community. And so that adds up when you're looking at families that are with their children here 5 days a week, you know, or whatnot. And so it's just that we have our next round of planning sessions on Monday, and I'm dreading bringing that to the committee because they were all excited. We just need some numbers and we can make it work. And when all of a sudden you see like 1.6 million, then you sit there with this like deer in the headlight look of like, who's playing the lottery tomorrow? You know, and is somebody going to win? Because none of us have a gold mine out there somewhere. So it's pretty daunting.
Cornelia, I appreciate you bringing that up. I'm wondering if we could, your tools that you're using to go through this process, if you could share that. And the reason I'm asking is because a lot of this is, we sort of stop the conversation before it even happens. Everyone knows we need to raise wages. And then we're overwhelmed with the number. And it just stunts creativity for how do we arrive. So you're saying 1.6 million. Okay, that's a lot of money for sure. We don't like what could be another payer in the system if it's not families and it's not subsidy and it's not sort of what's our other options for payers. And I think, I'm not saying that there's a solution to that, but I think having a dollar figure, if we think about public-private partnerships and we think about the business community and we think about philanthropy, either at a community level or at a statewide level, that's really the argument for public-private partnerships is to help fill that gap because we don't want to push that cost onto families. So I'd be interested in getting your planning tools, Cornelia, and seeing how we can leverage that information.
Hey, once we actually have something together that makes sense to
Yep.
everybody, because right now it's like we're trying to follow it all.
Yeah.
And so, but yeah, I'd be happy to share. We're basically just doing a comp and looking at, based off of education level, we're looking at school district pay and benefits.
Yep.
Because it's
Perfect.
not just pay, it's pay and benefits.
Yep.
Versus just living wage, you know,
Yep.
with pay versus where we are. You know, we can't necessarily compete with like the T-Mobiles who just changed their starting pay for call centers to $20 an hour. So literally you can like answer a phone at T-Mobile and make $20 an hour. And so like we can't compete with that.
Right.
Like, I mean, how are you gonna do that? And
right.
so, but if anybody's looking, there you go. And so there's that. But so yeah, I'd be happy to share once we have something that makes some sense. Yeah.
Thank you, Cornelia. Amy, go ahead. Amy Meek, sorry.
I was just going to echo your comments, Sarah, that that's such important information. Like that's what we need, Cornelia. And I'm so happy that you're doing that. Is if everyone could get, this is how much I really need to charge to reach the quality and to be able to provide the wages and the benefits. And I always think when we compare to school district salaries and benefits, we need to factor in a 12-month year working versus a 9-month, and the time off as well, because I think a lot of people, they talk about health insurance, but also paid leave. Paid leave for sick time and vacation, and factoring that in is super important. So we have the true cost. And so I appreciate you doing that work, Cornelia, and sharing.
Absolutely. And one of the things where all of us, of course, are dealing with not being able to find people right now, qualified people. And I was messaging and having a conversation with KSDE yesterday, trying to just figure out what to do to get qualified people for assistant teachers. And she said, well, you know, we can go on ahead and have our sisters take the para assessments. There are like 3 or 4 different assessments that you can take to be a para that the state will accept. But the hesitation and the fear in doing that is that once my assistants have that para assessment, they can actually leave us and go to the school district to be a para and make $15 or $16 an hour, you know, as the para. And so, you know, we almost like overeducate our people. We have people who we trained in conscious discipline and all kinds of whatever, and then they leave and go someplace else and make more money because now they have all of this extra training. And so, you know, it's like this catch, because the more we do to try to be able to give the education to our teams so that they can get more pay, then we lose them because then they can go someplace else and get even more pay. And so it's just this, it's quite the mess right now.
I think that's a great observation. I was thinking about the links to quality presentation and about like increasing quality and having some shared standards for what that definition of quality looks like at a program level and how that might impact you know, folks who are learning skills at a program level. And then if there's not pay parity with similar professions, K-12 being one of them, then are we training folks who are then going to leave? So it's almost like increasing quality and pay parity have to be kind of 2 sides of the same coin. And it doesn't mean we shouldn't do one unless the other is there, but they're really, it's interesting to think about that.
Right.
I just had a thought. This is Amy Gatchammer again. It almost seems interesting to me if we could create a little basic form, whether it's electronic or even just a template that somebody could print out that would tell them kind of how to determine what those numbers are, you know, to like here on this line, put in your current wages, your facility cost, et cetera, et cetera. And then, you know, now calculate or, you know, contact your school district or get a copy of the wage scale there and, you know, and kind of walk them through kind of what Cornelia is talking about, and, you know, and then provide that tool, that worksheet as something that other programs around the state can do on their own to help send their own messages and use numbers that are applicable to their area. It's just an aside.
I think that's great. That reminds me, that's very actionable. So I would love for, if you're following along in the Jamboard, you can go to slide 4. And there's also slide 4 and slide 5 are really about, well, just to level set, slides 6 and 7 are focus area 3. I am not anticipating that we get to those today. I'm just giving folks a roadmap for the next meeting as well, because we do want to move to some tangible recommendations at the end of our time in October. So that's just a frame for everybody. But slides 4 and 5 are where we can start to actually address the documented challenges, and you can review those things that we documented in the first 3 slides. So I did capture, Amy Gottschalmer had sent a few comments to me in between meetings, and so I've captured those here. One is just around the public awareness. We also have infrastructure around health and retirement benefits. And she had one idea, and I think I probably moved it into implementation, but a Job Corps model. So Patty, I don't know if that was something that that you had thought of in the past, but just thinking about like your role and training, but a Job Corps model as something that helps with recruitment and retention. So You all have access to use the Jamboard. So on just as a way of navigation, on the left-hand side, you'll see the arrow, and then you'll see below it what looks like a little square with a up folded corner and 2 lines on it. That's a sticky note. You can click on that and you can type in your ideas. I've organized these by short-term, long-term, what's being done now that we should scale. So what are good ideas happening now that we should potentially scale? You don't have to use those questions. You can drop your ideas in here in any way that makes sense to you. This is just a guide to help us think through what's something we can do now, what's something that is more of a long-term solution. So yeah, I will be quiet for a minute and see if anything that's here strikes a chord with you and you want to add on to that. You're welcome to type directly in it and I will call them out, or you can come off mute and we can have a discussion about things that you're thinking about as being potential solutions. I said I would be quiet, but let me just remind folks while you're reading, we talked about bonuses not being sustainable. So recruitment and retention bonuses not being sustainable. We talked about wages, of course, lack of understanding of advancement, professionals maybe not feeling the value that they need to feel to retain in the field. Centers where their directors or lead staff don't have capacity to offer that support that staff might need. We have the overwhelm for the on-ramp that exists with becoming a childcare provider. So thinking mostly about family childcare providers who are starting their own business, what does that look like? And little clarity of how to advance. So if I'm coming into the field and I'm excited about it, what are my opportunities? How do I know where to go from here? How do I know what's available to me? So those are some of the challenges that we documented. I know wages is just undergirds absolutely everything. And I think it's being talked about in a lot of different spaces, but nobody has a single magic bullet for that.
As people are looking at this, I'm just a quick question for Cornelia. As you were working on that and looking at actual costs, are you also looking at management staff and increasing their wages?
Absolutely, because what we're realizing is that, in our pay, when we look at our licensed teachers, for example, the licensed teacher's pay is not that far from our program director. And if we're looking at increasing the pay from our licensed teacher, then we have to look at increasing pay then for our program director and the assistant director and our assessment coordinators, or all of the people who are part of our administrative team. And so it kind of trickles up, if there's such a thing, it's supposed to trickle down, because we can't, if we increase assistants, then we have to increase leads, because we can't have our assistant teacher making more than the lead teacher. If we increase the lead teacher, then we have to increase the admin team. And so it's just kind of worked its way up, and it's quite daunting. I was just looking up, just like in Sedgwick County, for example, the living wage in Sedgwick County, if you have no children whatsoever, is $13.25 an hour. And so that would be the minimum that we would need to pay somebody with no children whatsoever. And our start is 11. And so that in itself right there creates, we understand now, okay, well, we have people, unfortunately, who are working with us, but qualifying for DCF, even though they're working full time, because, and that's unfortunate. But, even just kind of looking at the living wage in the county, then, and kind of using that as a base to where you are, is that a good start? So that's one of the things that we have in our, as we're looking at our formulas and that kind of stuff. So.
This is Amy Gottsheimer. I just piggyback on what Cornelia was just saying. We actually ran this exercise once, at least in terms of the pay parity, not looking at all the other costs in our centers, but at our local KSAYC chapter meeting. And we started with the K through 12, and we said, if you're a first year teacher with a bachelor's degree, this is your entry level wage. And if you have a master's, this is your entry level wage. And then we took those numbers and we started working backwards. And we said, okay, so if there's like a $4,000 or $5,000 difference between those two degrees, if you go down to a person who maybe has an associate and you back it off $4,000 or $5,000, and then a person with a CDA and you back it off a few more $1,000, that way you're starting to look at something that's a little more comparable based on the education. You still have to tweak it a little depending on what the job responsibilities are, but like say, if you're talking about an assistant or you're talking about a lead teacher, but that helped us kind of get a feel for what should somebody be making based on education anyway, by just working backwards.
This is Amy Meek. I had a question, or somebody probably on here is a little more familiar with where we are on our subsidy reimbursements percentages, because I would add that to the state systemic changes that should be considered. But I've lost track of where we are on those percentages of reimbursement at this point.
Jen or Lisa, do either of you have any information about that?
It is not on the top of my head right now, but I know that I can grab that information real quick, unless Lisa happens to have it. She's got a little bit more.
I don't have it, but I can find it. I can find it real quick.
Okay. She can probably get to it faster than I can.
And Amy, just to clarify, if I write this down, like, is it increase families who are accessing subsidy? Is it increasing subsidy rates? What specifically?
Rates,
okay.
Rates, yeah. To providers or families to pay to providers.
So not eligibility, but actually increasing the funding that goes into, okay.
Yeah, my understanding is that there was going to be an increase in the infant toddler rate for subsidy, and that may have already taken place. We don't take infants, and so we don't know about that. But to our knowledge, we haven't had an increase in pre-K or 3 to 5, or is in a pretty long time. And they have they do a research or analysis or something in terms of provider rates based off of all kinds of different criteria. And so they were reevaluating that. There was at the last one that I saw said that that based off of the feedback from providers, that they felt like that, and if I'm misspeaking, then somebody please tell me, because I don't want to share false information, especially when it's being like broadcasted live, and like I don't want to end up like on somebody's list or whatever, say something crazy. And so, but what I understood is that the feedback from providers was that they actually received the reimbursement needed to provide quality care. And when I looked at it, I was kind of surprised because I wasn't sure what providers they spoke to and what that definition of quality was, for the feeling that they received enough to provide that quality care. But I could have misread a totally different section, of that, because when you look at it's like lots of pages when they're looking at, the federal document and how much they're paying people and, all of that kind of stuff. And so I know that there was supposed to be some additional research or kind of looking into and doing more in terms of polling providers and trying to get some more insight, but I don't know what's happened with that.
Cornelia, are you the only one working in the field right now on this call? Is there anybody else? Okay.
Yeah. Amy and Riva.
I meant in a childcare facility. So
yeah, I'm in a program. Yeah.
They've recently changed to full and part-time blocks of time. Has that been useful to you? That has not been useful for you? Darn it, Cornelia.
And I don't want to be the Cornelia show and I like answer all these questions or whatever. So somebody else can hop in. It's helpful for new families that qualify for subsidy, but existing families won't roll over to the full or half-time block until it's time for their renewal. And so we don't see that because it's not time for their renewal. And so, we don't see that yet. It will happen eventually, but not yet.
Okay, thank you for that information. I mean, I'm sorry that it didn't make your life all roses, but I appreciate the feedback.
All right, so we have a note to increase pay at all levels, which is good. It's noted. And then we have the infrastructure for health and retirement benefits. We have tools and worksheets and calculators that programs around the state could use to calculate their own costs for quality care with pay parity, so they can message locally. I think public awareness in general of the cost structure. I know we have been talking about public awareness for quite a while, and I know there's been fits and starts with that. So it would be good to continue to elevate that. We have someone who added explore opportunities to expand practice-based training. So early care and education pathways to success, as an example, in California. And then we have the increasing subsidy pay rates to actually align with true cost of providing quality care based on a shared definition of what that actually means and is. So what other solutions can we think of that help with recruitment, recruiting providers to the field? Is there something people are doing right now that is being really effective? Is it, I know that childcare aware of, or maybe Child Start, I think, is doing a job fair for professionals in recruitment. And then one of my questions as we think about wages is, Cornelia, you mentioned $11 an hour, which I would imagine is higher than in some other areas of the state. All of it's still less than a living wage. Is a medium point worth exploring, or is it really all or like, I'm really curious what people think about. We raised wages by $2 an hour across the board, doesn't get our staff to a living wage. What would the impact of that look like? Or have we thought about maybe that's not enough?
Our discussion really is, okay, we may not be able to start people out at $13.25, but can we go to 12? It was 10 last year, and we moved it to 11. And so, and now we're seeing that that's not enough. So do we need to move it to 12? And we do pay, as Amy, you mentioned, based off of education. And also last year also added longevity. So if you've been here for 3 years, you make more than somebody that walked in the door. So trying to be able to recognize longevity and education and all of that. And so we are looking at, okay, so if the goal is to get to 15, we're not going to be able to get that. Could we get to 12 or 13, where at least that it's better, than minimum wage, and it makes us, and so we don't need to try to, we won't be able to eat the whole elephant at the same time. And so, what can we do? And so, but eventually with the goal of getting to where, again, they're being paid for the work that they do.
Yeah, I have a salary scale that when I have our new hires, I just look at, years of education and they get annual raises based on how many years they've been with us, and or how much education, how many years that they've been in the field. So but I do think that I like your approach in that, you kind of just try to get further, because something further is better than not moving at all. So even if you can't get to 15, and it may not solve our entire problem, because we're still going to be up against Target and Walmart and Chipotle and whatever. But what it does is positions our particular schools maybe in a better place against other schools in our community. It will help us keep quality teachers so that they don't leave and go to other programs. But I wish it was the whole answer, but.
What about strategies for retaining staff beyond compensation? What are some strategies that those of you who work in the field have been able to use? I think we had some examples last time about community communities of practice calls and other places where people got support. What works for retention? And what should we be doing more of, or what should we add to that?
I think we need more teacher appreciation weeks. They like food and gifts and gift cards and money and, just the little stuff. It doesn't have to be a big thing, but, just when we even do a teacher appreciation, we're able to give some gifts to them, but then the parents start bringing in thank you cards or a bouquet of flowers or something like that. Just all of those little things, knowing that not only does management appreciate the work they're doing, but so do the families, which has been exceedingly hard in COVID because they don't even see each other anymore. They're all dropping off at the front door. So we've been trying to do more and more of those kinds of things, just even on social media, making sure they know when somebody's having a birthday or somebody graduated or somebody, whatever, got married or something. So just a lot of acknowledgement and just lots of little thank yous and as much as we can.
I know somebody's already said this is Jennifer. But, I really do think things like it's a longer term thing, or even the other category that I can't see because our heads are covering it up. I really do think that having paid leave, being able to, take time when your own children are sick or you're having a health, it's a big thing. It wouldn't happen overnight, but that paid leave is important. And as are things like retirement. I know a lot of young teachers don't come in thinking about things like that, but in terms of having longevity and then having something to live off of once your career is finished, I think particularly in childcare, as you see providers get older, it's a physical job. And, having a retirement benefit or health insurance, I just see it as critical and the leave.
Jennifer, I know you haven't been in your position terribly long, but I'm wondering if there are any lessons from the Head Start world that, I know Head Start has its own federal funding, which is a little bit different than others, but I'm just curious how early Head Start recruitment and retention efforts might look that we could learn from.
I think it's complicated because they all look different. So there are some Head Starts that offer their employees all the things I just talked about, and there are others that are using every penny of their grants just to operate their programs. So I'm not sure there's any clear lessons. I know the big thing is this past week, the vaccine mandate coming down from the federal government is number one on everybody's mind, and how that is going to affect both their recruitment and their retention of staff. So I'm sorry, I don't have more positive, optimistic, but the reality is, despite the federal funding, every program looks very different.
Amy Gottheimer, did I interrupt you earlier?
I think I was just going to say that was one of those actionable items that I mentioned to you, that we try to see if we could somehow get early childhood providers into the CAPERS program, at the state level, so that they could get some retirement benefits, and that we could reach out to other states and see what other states are doing for early childhood providers. That I did know somebody that worked in at a higher up level like this, equivalent to what we're doing, but in New Mexico. And they were working on that last year, so that there may be other states we can talk to, whether or not they actually get into the exact same program as K through 12 or a similar one. Is it possible to put that together, and how does that get funded? But I think that would be an actionable thing that we could really look into, because people are doing it in other parts of the country.
This is Reva. I know Rhode Island did that.
This is Jennifer again. Sarah, going back to your question, I do think one thing that Head Start programs in general do well, and that does help retain staff, is the embedded kind of coaching that's inherent in the model and the professional development. And so I do feel like when staff members feel like they are engaged and there are strong supports in their program and people care about their professional development and their growth, I do think that that goes a long way with retaining staff.
I think you read my mind a little bit, Jennifer. I was going to mention or ask the question about that. There is a group that has been meeting on and off since April. It's the Professional Development Implementation Team is what it's called. And I think there's maybe one or two people on this subgroup who were on that as well. But the focus on a career pathway and how would a formal career pathway help with the acknowledgement of, this level means a certain thing. How would you align that with links to quality? Because that's the pathway is really for professionals and links to quality is really for programs, or at least that's the way it's set up right now. But how would you support, if we're going to say we want providers to be at this level, how do we actually support providers in getting to that level? Whether it's a certification, it's a set of competencies, it's a set of professional development. And does a structure like that, does that add value to professionals and wanting them to stay in the field? So retention. And does it add value when it comes to recruitment, to have a professional pathway that shows advancement opportunities? Obviously, a structure on its own without perhaps a wage scale or pay parity scale attached to it is just a structure. But I am curious if that feels like one more thing, or if that feels like that would be a value add for recruitment and retention. And it's not an or, it could be both. It could be an and, given all that's going on in the world and in providers' lives right now.
Amy, you said that you were using a leadership model with your staff. Have you seen that those who are taking more leadership are staying? I mean,
it's not 100%, but a lot of people just have life happens, right? Somebody gets married and they get transferred out of state or whatever. So I haven't been able to retain everybody, but yes, I think the people that generally what I do in terms of leadership is I create sort of subspecialties within my building. And so we have our specialists that focus on specific areas of care. And then the rest of the staff can go to them, or they have certain expectations for things that they do building wide, in addition to their lead or full-time teaching positions. So they get a few extra hours a month and a bump in pay for taking on those specialties. So I do think that gives them more of a vested interest in the success of the school and the success of our colleagues. So it is helpful, and I think they feel maybe a little more empowered.
I feel like you're running a little mini pilot for us. Thank you.
Okay, we have about, I think, 10 minutes or so left. I think Amanda's given us till 11:05 because of the conversation this morning. I just have a quick, another filtered question. So what might be unique to rural communities, and what might be more unique to urban or semi-urban communities? I'm asking that because we did have some sub-grants through the preschool development grant who did a lot of boots on the ground outreach for sort of communities of practice for rural providers to recruit providers in rural communities. I'm just wondering, we might not have as much rural voice here on this particular group, but I know Patty, your team at Casito does a lot of that stuff. Just kind of curious what people have when it comes to uniquely rural solutions that we need to consider, or vice versa.
It's just a general comment, not really specific to that, but I know even the few, I know out in Hayes, they had an article was posted and different. I think really a lot of that media coverage around the lack of childcare in rural areas. I mean, it's gotten back to us, and we've, heard about that people really are paying attention to those just at the community level. I mean, we're, from the rural communities hearing it more and more, about the lack of care in general, but just kind of a side note I've been surprised with the number of contacts I've received, outreach about questions about, referring to certain local articles about the lack of childcare around the state of Kansas, and it is garnering some attention. And thinking about how we could, continue to push that drive as well to, get in those local newspapers and talking with the local providers. Surprised that it's made its way back.
This is Amy Gottchamber, and although I'm not in a rural area, in my role on the Kansas Association for the Education of Young Children board, we have talked about trying to set up rural chapters in rural areas and such, and it just the message that I sort of generally am getting is that they are very isolated. And so, discussions that we have, here, there, and in more metro and urban areas, they aren't having. They're really just in their own little places. And so there's less growth, less professional development going on. And that I think one of the things we've discussed is, would they benefit more from, the move to virtual that we've all done, and being able to be in peer learning communities and things where they could grow and connect and be with other people that are also in rural areas. But then you've got the barrier of the connectivity, and or do they have the computers or tablets and the funding they need to pay for a monthly service? So there are definite barriers out there that will have to be overcome. But we feel like if we could overcome them, that the technology piece could really help to bring them together and make them part of professional communities.
This is Kim, and I wanted to go back to Patty's point, while Amy brought up some very good points about, the technology piece. But, coming from a rural community myself, I feel like that, the lack of childcare is nothing new. I mean, I experienced that trying to find childcare for my own children. And I think that in those areas that have experienced a lack of childcare for so long, there's kind of the mindset that that's how it's always been. And we're rural, and that's how it is. And so I think that, just part of that, that media push at getting that information out, that, perhaps other rural communities would see, oh, well, Phillipsburg had this problem and this is what they did, or, oh, look, to possibly, maybe be able to see some other solutions in communities that are similar to them and that they can identify with. So that's my 2 cents.
I'd call that 5 cents, Kim. That was great. Maybe
like
10
need
cents.
To bring back the one-room schoolhouse, but that they all need to be childcare programs in all of these little communities.
I would echo from the childcare systems improvement team. There's a rural working group there, and there is some just like, well, we don't it's different in rural communities. And, you know, the response is maybe, but children should still be in high quality, safe, early learning settings. And that doesn't have to, maybe the structure of it looks different, but that doesn't mean that we should be have different expectations of the environments or the quality of those environments for rural versus urban kiddos. So that's definitely been a narrative that's come up in other ways. Kim, go ahead, Reva.
I just have, I guess, a question or something that's just on my mind as we have this discussion, and that is, how does illegal care fit into this picture? Are we inadvertently pushing families to choose illegal care because there isn't enough supply? And then how do we, how do we move those people into the system? How do we message that? I'm sure some of them are wonderful and may not even know they are supposed to be licensed. And then there are those other people that are very intentionally choosing not to join the system, but keeping the economics and the cost of childcare out of whack in their community because they're bringing competition to the, to the table in a disproportionate way. So I feel like one advocacy piece that really needs to take place that maybe hasn't been yet is some conversation with the district attorneys across the state, because even when licensing identifies an intentional illegal care provider, there doesn't seem to be a good way to address that or force them to come into compliance.
Reba, it's like you're reading my mind. I don't know if you can see the Jamboard, but I put something on that, like just as you were talking, moving my Post-it about. And I do think some of those conversations have happened with some DAs, and it's not, we're not getting anywhere. I'm hoping for more incentives to bring some of those folks into maybe a carrot instead of a stick. Maybe a little bit of both.
Yeah, I agree with that too, Jen. Thank you for noting the incentives for those providing unlicensed care. I do think, Reva, to your point, there are folks who just don't realize they're unlicensed, but I think the comment about skewing the local cost expectations for families is a real challenge. And I think speaks to what everybody already knows, which is you can't increase family share to fill the gap. So what are other solutions? So I appreciate that. In the final 2 minutes, I just wanted to set some expectations for our conversation next time. So when we meet in October, I'm going to do some work to organize this in a way where we can actually like this, then this, then this. So we went from problem to here's a couple solutions. And then I think we'd like to identify as many recommendations as we can that we might elevate to the full panel. We don't have to have all of the formal language done at the end of October, but I do think in this conversation, if we could get to some maybe 1 to 3 recommendations is what I kind of have in my mind. And then our team can go back and put them into a document, and we can go back and forth via email offline and just make sure everybody in the working group is good with it. Doesn't mean we stop the conversation. It just means that, we don't spin in, we actually move to some kind of recommended solution, and we give some thought to who would be responsible for implementing those solutions. So there's lots of ideas on here. Some of these are big and complex, and how do we break them down into first and next steps? And I'm happy to help pull in other resources, pull in other partners who need to be at the table, either through our SIT, our licensing teams, our DCF teams, local communities, other subgrantees who've done this work. So be thinking about implementation, identifying of a 1 to 3 solutions, and then thinking about how we might recommend implementation happen. So, wages, yes, but how might we actually go about implementing increased wages. And some of that involves awareness, understanding of exact dollar amounts, giving people tools. So again, we don't have to have all the answers. We don't have to know where all the money would come from, thank goodness. But just putting down some next steps for implementation would be helpful. So that's what we're going to do next time. In the meantime, if you have any other thoughts or questions, I'm going to leave the Jamboard open. We'll send it out. I'll have Debbie send it out in the follow-up materials so you can continue to add to it. And it can be a living document for us to work from. So 100%, Amy, to your comment in the chat about public-private partnerships and where people are going to get more funds if they are successful in that at a local level. So I think I get to excuse you guys back to the main room. Just let me make sure. Yep, 11:05. I'm kept you a minute over. Thank you guys so much for the great conversation, and we'll see you in a little bit.